George, shall we tell the Pulse Potties what we want for Christmas?
Yes, there's one thing you can do for us, please. That is to subscribe to Pulse in your favorite podcast app. That would make my Christmas great.
Yeah, and please give us a rating and help George get an even bigger smile on his face. These ratings and your subscriptions, they really do help other people to find us and to keep the AI algorithm overlords happy.
Yes, you can help us to achieve a Christmas miracle and get Pulse into the ears of even more of your digital health tragic friends.
Absolutely. And now back to the show. Welcome to 2025, Pulse Potties. I hope you've had an enjoyable and relaxing start to the year and that you haven't broken too many of your resolutions already. If you have, it's completely cool. I've already broken one of mine, which is why I don't usually set them. I'm your host, Louise Shaper, and I'm just jumping in here quickly to introduce today's episode. As you know, George and I recorded a bumper episode for our year in review, which turned out to be too big for one episode. So we decided to split it into two. Part 1 aired just after Christmas, and so this is part 2. So here we are, continuing with our year in review. Enjoy. All right, well, another big theme of 2024 was, of course, virtual care and telehealth. Now, everyone seems to know that the state where I'm based, Victoria, is broke. But I've got to tell you, living here, it doesn't feel as bad as it sounds. We've seen the expansion, here talking about virtual care, we've seen the expansion of the Victorian Virtual Emergency Department. And I understand it's got the capacity to deliver virtual care to more than 1,000 people every single day for urgent care.
Yes, so virtual care and telehealth. How many years have we been talking about those, Louise? But again, COVID was one of those things that drove that. And the virtual emergency department is such a great concept in that it delivers a service exactly where it's needed rather than rely on a bunch of ambulances to take people from their homes to the emergency department to get the care. We've seen significant use of it in aged care. Aged care facilities are using it to avoid hospital admissions by getting emergency care delivered where it's needed, when it's needed, at the right time, and avoiding getting people in their 80s into the back of an ambulance and travelling them halfway across Melbourne to wait in a queue at a hospital. We've seen it at the other side. Virtual Kids in New South Wales here is another great example of how they're using these services to make access to top paediatricians available to people in the inner city, in the regional areas, in the middle of nowhere, some of the places in New South Wales, and removing that inequitable challenge we had of distance, because the NBN and the great telecommunications infrastructure we now have in place in Australia enables us to deliver high quality care using these tools. We've been talking about virtual care for many, many years. Now it's becoming the norm, and even the health ministers are talking about how great it is. So it's been a long time coming, but it's a great service.
So good. And I love the naming of things as well, like virtual kids. And I believe you've now got virtual adults. And here, the Victorian Emergency Department, Virtual Emergency Department. So people think, why would I go to an emergency department? Oh, well, there's a virtual one. I'm not bleeding out. Maybe I could make a phone call instead. So that virtual adults, you've got that rolled out. Is that like a triage service in New South Wales?
Very similar type of service. So again, a step beyond what the health direct type thing is, where it sort of says whether you need to see someone or think. They're actually providers behind there managing through the process. And if it needs to be escalated, if you really need to see an in-person doctor to solve the problem, then it'll facilitate that and help streamline it. But we've seen so many times that our emergency departments are crowded with people who really just need advice, and they can deliver that advice virtually. They can e-prescriptions. You can now get the prescriptions. You can trot off to your local pharmacy 5 minutes later and actually get the drugs that you require or the treatment modalities you require.
And then they'll be on the My Health app.
And it'll be on My Health app, so you can use that. And, we're going down the track. The data will be shared with that, because the discharge summary from the virtual emergency department will also be on your My Health record. So there'll be continuity of care will be sorted out. It's becoming mainstream, and we're used to using so many other services virtually. Healthcare, when it is suitable, can be delivered just as effectively during telehealth solutions as it can in person. Yes, telehealth is not going to give you a cast for a broken leg, but what it is going to do is advise you that, A, it's not broken, and here's the best way to go forward through it. So I think it's a really exciting time.
It is. And actually, a friend of ours, someone that both you and I know, George, I saw him recently. This guy had, unfortunately, a cancer diagnosis in 2023, but he received the bulk of his chemo from the comfort of his own home, thanks to a program run by New South Wales Health. He doesn't live metro, he's out of the major city. And I saw this guy recently. His cancer is completely gone, which is, of course, wonderful. And he's super happy. But even when he was telling me about, his current health status, he couldn't help but mention how happy he is to not just be healthy, but the impact of his cancer treatment was minimal because he was able to stay at home in regional New South Wales. On top of the stressing diagnosis, he didn't have the stress of an inconvenience of having to travel into the city to get his treatment. It was all done at home. I'm not sure how commonplace the virtual cancer wards are, but I hope we see more of those. He certainly had lots of positive things to say.
I've had some family members with similar experiences. Again, chemotherapy is not a fun process. Being able to do it in the comfort of your home with someone nearby to make you a cup of tea, your TV in front of you to watch the TV program you want to watch, your dog or cat by your side watching you as you have going through it, all those sort of things make a big difference to the psyche of going through this treatment. Again, when people go through chemotherapy, it's not a one-off. This can be 12 weeks of 3 times a week treatment, which leaves you tired and your hair's falling out and your appetite. Well, if you're at home amongst loved ones, and the biggest thing a lot of people, when they talk about this, talk about the beauty of having their pet by their side, the dog sitting on their lap while they're having their chemotherapy, just makes it a little bit more bearable, because the biggest challenge we face with chemotherapy is people drop out of it because it's such a tedious process to go through. Anything we can do to make them have that extra couple of therapies to get them just over that roadblock. And I'm glad that our friend has managed to beat the beast, as they say.
Yeah, absolutely. It is very good. And yeah, you're right about the dog thing, because after we stopped talking about the cancer and this person has grandchildren, no, we didn't talk about that. And we talked about the dog, and I got to see pictures. And it was very cool. And there's been so much stuff happening in virtual health here. Like we said, so the Austin here in Victoria there, they've got a virtual ward and they've now made it permanent because it's been so successful, their hospital in the home model. And I believe, like Kate reported, that they've now managed to deliver over 20,000 bed days at home in just 1 year. Like, it's pretty remarkable stuff.
I mean, it's also an interesting work that Medibank Private, in conjunction with Calvary in South Australia, with their virtual hospital systems. So we're starting to see new ways of thinking about it. So in the past, we thought about it as just, a video consult replacing an in-person consult. But now we're starting to see new ways of thinking about it, so that remote patient monitoring of data, engagement tools, and we've seen huge strides in mental health support using virtual tools as part of that as well. Our old friend Eric Dishman used to always say that the challenges we face in many of these things weren't technology challenges, they were imagination challenges, thinking about how we do it differently. And the fact that now the tools are available. I mean, as you know, I was involved in some major telehealth projects 10, 12 years ago, and the tools often let us down. They weren't up to scratch. They were ridiculously expensive. They were very complex. But now a $99 phone that you can buy over the counter at Coles has camera ability to capture your pulse, can connect anywhere in the country. The technology's gone leaps and bounds. We now just need to think about how we utilize it better.
Absolutely. Yeah. And one other thing that Kate spoke about in her review article, which I thought we should touch on, was the research that came out of Queensland looking at video consults versus phone calls. And their research, there's been heavily debated, and we're still seeing, especially in GP land, if you're going to have telehealth, there seems to be a preference to pick up the phone rather than video. I'm always the pain in the ass patient, to be honest. I insist on video. I'm paying for this, turn your camera on. But the research out of Queensland did suggest that video consults could actually be more effective than phone calls in the long run.
Again, the more data we share during those consultations, the better. And the ability to eyeball a patient, the ability to have eye contact and sort of look for subtle body signs that come into play, the ability to point to where the pain is. I mean, it's all well and good saying it's my left elbow, but I'm well known for confusing my left and right very regularly. So therefore, being able to point to it and sort of say, here's what it hurts. And simple things like saying, okay, well, lift your arms and tell me what it hurts. I think video is critical for telehealth to go forward. The phone has its place. It's great. And during COVID, when we had no other option, we used it a lot. for short, sharp communications. But as we move into a more longitudinal model of care, I think the ability to interact and see each other and share things and share screens, because when it comes down to sort of saying, here's what I want you to do. I mean, I can say, I want you to use drug X, Y, and Z, but if I can also then share a screen showing you the indications and the contraindications and the side effects and send you a copy of that screen remotely as well, so you've got that information. I think the richer the engagement, the better the outcome. So I think video is critical. Video cameras are 1995 at Kmart. Gone are the days where we needed to have a 500. One of my very first telehealth projects with Queensland Health back in the days, where the Polycom units were $250,000 each.
Yeah.
That's now replaced by a device for $99, which you can also play Tetris on.
Multiple things. I completely get the health outcome benefits, but what I didn't realise, Queensland covered this in their research, was the reason it's more cost effective is because their research showed that if you're using video, it's likely to lead to better health outcomes and fewer follow-up appointments. So in the end, the overall cost to treat you and to care for you with that particular condition, it does make it more cost effective overall.
Yep, that increased level of engagement leads to asking more questions, sorting the problem out. It's very easy on a phone to sort of answer the question and then hang up. But when you're having a conversation with someone face-to-face, be it virtual or in reality, you engage differently. So I think it's really important that we keep those sort of things in mind.
That's right. And it was good to see towards the end of the year in October, Medibank released that report they did in conjunction with KPMG into hospital in the home and other virtual hospital models. And they actually reported part of it on the financial modelling. They reported that there would be that an expansion of these types of models of care could save $1 billion in healthcare costs in 2030. And, potential savings, $6.4 billion by avoiding capital expenditure on new physical hospital infrastructure. Do you think that'll make a difference, George?
I apologise to our builder friends who are going to lose opportunities to build some brand new hospitals, but the reality is we have the capability of delivering that same level of care directly into the home. Whilst I'm always worried about when we talk about savings in healthcare, because it really is money spent elsewhere, but spent to better effect.
Spent differently and better, yeah.
The $6 billion we would have spent on capital expenditure, we may spend on seeing 20% more people at home, delivering care directly to them and increasing their health span. And we've had many discussions around health span versus lifespan, and I'm sure we will in the new year as well. Quality. It all comes down to quality improvement. I think we can really utilize these to improve quality of life. And the experience of illness is bad enough when you include social isolation as part of that, or when you include having to travel 30 kilometers and spend $50 parking to go to the hospital to get something done. All those sort of things factor in to improve quality outcomes.
Absolutely. Although I'm not sure what are the ministers of health going to do if they can't stand in front of big buildings with red ribbons and cut them open.
I'm looking forward to the day when they're sitting in a data center with a whole bunch of flashing lights behind them and sort of saying, see this computer over here? It just saved someone's life. So.
Excellent. Oh, I love that image. All right. Well, no doubt we will be visiting these topics a lot more in Pulse in 2025 and beyond. So on that note, I think it's time for another brief interlude. Welcome back, Pulse Potties. George, shall we talk about the biggest topic that dominated headlines throughout 2024?
What could that possibly be, Louise? AI, yes, artificial intelligence, a term which has been around for decades but has become key term for discussion ever since the launch of the ChatGPT, less than 2 years ago, isn't it now?
Yeah, I know. It's incredible how much things have changed. And obviously, we've talked about AI a lot on Pulse Pod, and it's been covered in Pulse+IT as well. Give a few highlights that Kate mentioned in her year in review about AI making a splash within the Australian healthcare sector. So Best Practice, which is effectively a GP system, announced early in the year that they integrated an AI transcription tool from Lyrebird Health, an Australian startup, saying that it was the first fully integrated generative AI tool for GPs in Australia. And then we've got Magentis, the company behind Genie and Gentoo. They announced that they're going with Google Cloud specifically to develop AI solutions for medical specialists. So generative AI in large language models being used every day by specialists, that's a game changer. InterSystems, they announced that they are adding an AI-enabled assistant to its Track Care platform and an AI co-pilot for HealthShare Unified Care Record, which will allow clinicians to easily search through longitudinal health records, but using chat technology. And then global electronic medical record vendor Meditech, they also are working with Google Cloud to develop an AI-powered search and summarization capability in their Expanse EMR. Now, I haven't seen it in operation, but apparently clinicians can find the information they need, and the interface is similar apparently to Google's, search function, what we're all used to.
What that demonstrates is it's used across the spectrum of healthcare, from general practice, specialist care, hospital care. Everywhere has an opportunity for AI to play a role. And we were recently at the AI Care conference and we saw many, many examples. Can't go past the Australian company Harrison AI. They've basically become world leaders in the use of AI for radiology analytics and then now also for IVF analytics. And they've raised $150 million in venture capital, which for an Australian company is amazing.
Yes, it's a huge vote of confidence, really, from the market. That's really unheard of here.
And their product is impressive. The people behind it are very impressive. Well, I had the opportunity to meet Angus and Dimitri Chan very early on in their career. And these are, amazing young men who, one was a doctor, one was an engineer, who saw a need, saw what technology could do. Dimitri literally self-taught himself AI to be able to develop these solutions because there was no classical training in AI 3 or 4 years ago. And these solutions are, when I was recently in Hong Kong, they were highlighted at that event as biggest innovations in the world. And I understand RSNA, the big radiology conference in Chicago earlier this year, back in November, Annalise and Harrison were up there as the world leaders. So again, Australia's batting well above its weight. Our good friends in AI, like Enrique Carrera, have really been highlighting the way forward. I think it's really exciting times. A little bit hype. Those of us old enough to remember the dot-com bust of the 2000 will know that sometimes the hype precedes the innovation. So sometimes you don't necessarily have to believe everything we read. But again, I think that's where I think Kate's done a great job in sometimes scratching under the surface and making sure that what we're talking about is real.
Yeah, absolutely. And we'll revisit it on the pod in 25, hopefully in the first quarter, because we mentioned in a previous episode, George, that there's a group of pretty serious medical institutions in the US and they are currently evaluating a number of AI tools and they're going to rank them and make all of what they find out when it comes to clinical efficacy available publicly. So you've got OpenAI, Google, these huge tech behemoths, and one of the companies is also Harrison AI. So great to have Australian innovation being such a big player on the global market.
Absolutely. And as we know, I mean, some of our colleagues like Martin Severatne, if comes to mind, who got actively involved in this space a few years ago.
Yes. Isn't his brother an engineer as well?
He is, yes. I'm sure Martin is destined for greatness. I have a lot of faith in Martin.
He is doing amazing stuff. Yeah. I think he's still in London with his own startup now and left Google. But yeah, it is really impressive. Like you said, we have to look at the hype. And I think you and I do a pretty good job of being excited about these developments, but looking at also the pitfalls and avoiding the hype. And, there was that evaluation that Kate also wrote about in Pulse+IT from CSIRO and University of Queensland earlier in the year, which highlighted, not surprisingly, but hey, we need to do a lot more testing and validation of these systems before we just sort of let them loose on the healthcare sector.
Yeah, look, this highlights that whilst this AI trend is amazing and we're doing some great things, the age-old scientific method of evaluation, experimentation, reporting on, and continuing improvement is critical. And we can't ignore the way we developed evidence for many, many years still needs to also be assigned to these tools as well.
Absolutely. And I did see, you mentioned the RSNA conference, the radiology conference. I did see a LinkedIn post. Can't remember who it was from. But anyway, it was in my feed. It's probably popped up in yours because it had a lot of comments on it. But he was basically saying, so I'm at this conference, big radiology conference in the US. And he's like, I'm sorry, but AI has already been let loose on the healthcare system. There was AI systems everywhere claiming, they're going to solve world hunger and other things. So a little bit of hype, and regulators were sort of missing an action.
And again, this is something which is moving so quickly that regulators in healthcare aren't used to this rapid iteration and they're going to have to change. We heard Enrico speaking at the AI Care conference about the need for regulators to be better informed and be deeply engaged in this, and for academics to also have proper training so people can know what's happening.
Yeah, that's right. And I did see as well that in October, the Department of Health and Aged Care did release a consultation paper on safe and responsible use of AI in healthcare. And they were calling for submissions from industry, clinicians, consumers. So I'm sure we'll hear about the results of that consultation next year. But we certainly do need, and Enrico and his colleagues at the Australian Alliance for AI in Healthcare, they've got a great roadmap. We have to make sure that AI is safe and responsible. But Enrico made a good point that despite they were leading, they built that organisation, way before COVID, like way before anyone except for a small group were talking about AI in healthcare as being a real thing. They built this organisation and can't get any funding. There's no funding for the roadmap, and regulators need funding as well if they're going to get on top of this stuff.
Even though they talk about this as a multi-trillion-dollar opportunity in industry, yeah, right, that organisation was formed prior to COVID. I remember I was at the event they had in Sydney where they actually had Anthony Chan from the United States over here as well. Australia's been very proactive in this space for doing a lot of great stuff. But nothing works without funding. I mean, people like Enrico can't afford to do this as charities, and we need to make sure that those organizations are properly funded. So we've seen responsible use of AI in healthcare, but we've also seen a national AI strategy. We have all these great visions of how we do it, but you need to core infrastructure, things like regulatory authorities, evaluation services, properly rigged academic training around it. All these sort of things are core tools for this to become a success. And sometimes we need to make sure we don't outpace them and forget about them, only to realize down the track that by missing out on those things, we now have an unsafe, unstable AI system. Wasn't that how Terminator started with Arnold?
That's right. I like to think of myself as Sarah Connor. Yeah, I've got to get back to the gym. Yeah, well, AI has been a huge topic, of course. I don't think that's going to change in 2025. We will be talking about this a lot, probably every episode. But we are going to have a digital scribe, an AI scribe related dedicated episode in the new year as well. We're getting a lot of requests for an episode focusing on that. So we've been lining up a whole bunch of guests who are going to talk us through the current status and what you need to know about AI scribes. And I think that's going to really take off in 2025.
Of course, we need to keep in mind with AI is that behind that AI is a large number of computer processors chugging away. And had we all known and bought some NVIDIA shares a few years ago, Louise, we probably would be doing this on our yacht today rather than from our home offices.
I like that mobile studio, but on a yacht. Yeah, okay. You're always thinking, George.
But the reality is the requirements for core infrastructure are just going to grow. Just a couple of kilometers from my home, a new data center has gone up, this huge, massive building. They're actually running some of the fiber to those data centers down my street. So we've actually had people digging cables from Maroubra Beach through to Alexandria. So the requirement for infrastructure is going to be critical. And then we need to start talking about the discussion we had earlier, how do we make sure this remains secure? How do we make sure this is a national asset that we need to play with? I think there's going to be some really interesting opportunities going forward.
Yeah, absolutely. Well, there was, of course, a heap of other AI stories this year, but we need to wrap it up because we need to touch on what's happened in the world of digital health with our friends across the pond in New Zealand.
Yes, New Zealand. I won't make the same comment I made last time, but again, it's interesting watching the challenges smaller nations face with limited resources. And whilst they have great intentions, and I've attended a number of events in New Zealand, and we've imported many New Zealanders over here to Australia and vice versa. But 2023 was a very exciting year for New Zealand digital health. They took our good friend Lee Donoghue and had a great vision and plan for how they were going to dramatically digitalize their system and thing. And yet 12 months later, the world has changed.
Yeah, it's not good. It didn't really end on a banger for the people of New Zealand who, just want and deserve high quality healthcare, but digitally enabled. I mean, it seems ridiculous to have a conversation in 2024 or even 5 years ago about high quality health outcomes when you're not digitally enabling your healthcare service and the clinicians who work there.
They had the vision. Lee and his team were a highlight at MedInfo talking about the future vision of how they were going to achieve. And they had a plan and they had everything in place. Unfortunately, they didn't have enough New Zealand dollars to get there. So, and a change of government and a change of initiatives. And again, this is one of those challenges with the politicization of healthcare. Because it was the other side's idea, it's no longer a good idea, is always a challenge. I mean, healthcare should sit a layer above that. And I think New Zealand may well woe the day that they decided to cut the funding of their digital health groups. I guess the bright side is there's a whole bunch of really smart people in New Zealand who are waiting to come over here to help us with our system.
That's right. It's just a recruitment drive for Australia here. But actually, I wanted to quote what Kate wrote in Pulse+IT because she wrote a really rather dramatic description. I thought it was a good one. So this is the quote from her. And she said, "The late Queen Elizabeth II once described a particularly trying year in her family's life as her annus horribilis." And you can't really go past that description of quite a disastrous year for the beleaguered staff of Health New Zealand, Te Watuora's Data and Digital Division.
He did capture the essence of it really well in that they sort of, from the great heights of, again, mid 2023, when Lee was one of their keynote speakers at MedInfo and spoke about the vision, and we all sort of went, oh, wow, this is amazing. We're going to watch with great interest, to by the end of this year, Lee's gone. Most of the organization's been pulled apart. Everyone's scrambling around to work out where they're going to. They definitely have had an annus horribilis. And again, I'm sure they'll bounce back. There'll be opportunities for them to do things. Australia always does need an extra state we can add to our federation. They can sign them up and bring them over. Maybe that might be an opportunity. But
apparently that was a thing. Sorry, not a health topic, but I only found that out recently. I was talking to someone in New Zealand and they made that joke. And they said, back in 1901, we were going to join. And I didn't remember that from high school or primary school whenever I learned about federation. But I knew WA was the last holdout and then ended up deciding to join. But I didn't realise New Zealand was going to be part of Australia. It was all going to be one country.
That did sort of reflect the colonial thought, wasn't it? It was,
yeah.
Our colonies in the Antipodes. But having said that, I mean, New Zealand, again, has some very unique challenges. And then they have done some things better than us. So their Indigenous health outcomes are better than ours.
It's embarrassing in a comparison. We're not even halfway. And they're just the acknowledgement as well of culture.
Our good friend Bern Shen from the United States has always looked forward to retiring and spending his years in New Zealand. It is a magnificent country, the landscape, fantastic people. It does suffer that challenge that it is a relatively small population that needs critical mass. And we probably should work out some way of better collaborating within our systems, because I think we all have a common goal, and I think there are opportunities there, but it's disappointing. But hey, maybe next year we'll be talking about it in a different way when a bit of change of heart may come in place, and we may be saying, well, just like New Zealand, we should be doing X, Y, Z.
That's right. And for the Pulse potties who haven't checked out Pulse+IT, there is a New Zealand edition, and there's an excellent journalist named Rish Lyon over there in New Zealand who has got a few scoops already in his time there. So there'll be hopefully some good news. Well, it can't get any worse, surely. So hopefully there'll be some good news. George, I did catch up with some friends in New Zealand recently, or, online, and one of the things that I didn't really appreciate, and they were saying it's so bad over there now that because 650 people have lost their jobs, or full-time equivalents lost their jobs. So apparently there's been contracts put in place for, vendor to deliver X service or product into Health New Zealand. And the vendor, who still has a contract, it's not like it was all wrapped up, they don't have a contact anymore. Like, they don't know who to call to see, where's the project at? Okay, next steps, or we've done it, next milestone. They don't even have people.
Who do we deliver to?
I know.
Exactly, yeah.
I was like, oh my God. So, yeah, I just didn't realize that the chaos, I'm sure it's incredibly depressing, but the chaos that it has created as well.
And obviously financial issues cause this. They obviously have financial challenges. And we've seen that across the globe, cost of living and all those sort of challenges, inflations and whatever. I'm sure the people who made this decision didn't take it lightly. I mean, I'm sure they didn't come into the role thinking we're going to destroy digital health in this country. But at the end of the day, the Treasury is the limiting factor. And again, it just highlights that need for a forward plan, a vision of what health looks like, and some way of controlling the politics around it. Probably we'll touch on it, but we're about to see some interesting politics take place in many places around the world. And I'm sure we'll have lots of discussions in 2025 about political initiatives in healthcare from other countries that we will want to discuss as well.
Oh, absolutely. We certainly will. And another shout out to Pulse+IT. There wasn't a year in review because Pulse+IT hasn't covered a whole year's yet, but there is a journalist in Ireland covering the latest news and updates of what's happening in digital health in Ireland. And in the new year, we're going to feature some pretty excellent guests from Ireland, let's say. We'll just tease that to go into a deeper dive on what's happening in Ireland as well. So we'll make sure we cover that next year too.
I am hoping because I'm actually off to Barcelona in the new year for the Mobile World Conference, which has its Digital Health Summit, to learn from some of our European colleagues. So again, I think one of the things we haven't done very well is ignoring other parts of the world. So in Europe and Asia, some interesting stuff happening. So we need to have much more collaborative models about how we do this.
Yeah, absolutely. Okay, George, what a banger of an episode.
We've described that we've had a great year in Australia with lots of things happening. New Zealand's had its challenges. We haven't really touched as much as we could on the global situation, and I'm sure we'll be discussing that in the new year. Lots happening, lots more to happen. The challenge has always been, and I touched on it earlier, this quote, my old boss, Eric Dishman, it's not the technology challenge, it's an imagination challenge, and how we do this better, how we integrate these new technologies into healthcare to provide direct benefit to both consumers, patients, clients, call them what you like, and clinician, how we prepare our workforce to make sure they utilize these tools to best effect, how we learn from AI and how we make AI improve. And we'll be watching that in a lot of space. So all these themes are something we'll be discussing in a lot of detail in the new year.
Yeah, absolutely, we will.
Keeping in mind that AI report from the department is due out soon. There's so many reforms coming ahead and the potential of an election in the new year. The ITAC conference in March, which will be looking at innovations in aged care. I'm really looking forward to 2025.
Yeah, because January is looking busy. I'll let you know, but I'm hoping I might actually be coming to Sydney for a couple of weeks in January. And then I'm also hoping to get to Arab Health at the end of January as well, because there'd be lots to report on there. So anyway, I'm going to try and get there.
I did attend the Arab Health this year. It's a very interesting event. I would highly recommend an opportunity to go. And make sure you make contact with the Austrade people over there. They're doing a great job in linking people up there.
Yeah, no, I know those guys. They're really good. And then there's the Global Longevity Conference in Saudi Arabia, early February. I can get myself over to Dubai. I'll stay a little bit longer and get to Riyadh. So anyway, that's my Christmas wish, is that I can work out a way of getting there.
Well, if anyone is listening and wants to have someone in Saudi Arabia and Dubai who knows digital health from end to end, I highly recommend you support Louise's trip to the Middle East.
Thank you, George. Thank you. Well, that's a wrap on part 2 of our year in review here on Pulse. As always, thank you so much for tuning in, and thanks for your ratings and reviews in your favourite podcast app. George and I really love hearing from you guys, and we appreciate your messages and the shares on social media and telling your friends about the show. So thank you so much. George is going to be back in the Pulse Pod studio for our first recording of 2025. So we will see you back in the studio then. See you soon. Bye.
Thank you all for listening to Pulse, brought to you by Pulse+IT News. Pulse is produced by Ivan Jurek of Octopod Productions. Big thanks to Kate McDonald and Emily Mara for contributing to today's episode. Subscribe, follow, and rate Pulse wherever you get your podcasts. You can subscribe to Pulse+IT magazine at www.pulseit.news. Send your feedback and questions to pulsepod@pulseit.news. All the best for the new year, everyone.